The purpose of this video is for me to demonstrate the technique I use for a one-person catheterization of a large breed male dog. Mr. Moose here was diagnosed about a year ago with canine dysautonomia. The result of that diagnosis is he no longer could fully vacate his bladder on his own. That means I have to catheterize him twice a day. At first I was very anxious because the procedure that was demonstrated to me at the vet's office used two people. I live in a very rural part of the country and don't always have a second person to assist me. Full disclaimer, I am not a vet, I am just a dog mom. But I've, over the course of this last year, performed this procedure about 700 times. That being said, it is very helpful to master the two-person technique before attempting the one-person technique, only because you get the mechanics of the procedure down and you have that second set of hands in case any issues arise. It is definitely possible to perform a one-person catheterization at home in a sterile manner. Let's begin. The most important thing when you're performing a catheterization with only one person is to get yourself organized and set up prior to beginning the procedure. So what I have here is a 60 milliliter syringe that I attach to the catheter, a 3 milliliter syringe that I fill with sodium chloride solution to clean Mr. Moose off prior to the procedure, some lubricating jelly, a pair of scissors, my sodium chloride, I got my catheter, and I have a receptacle to collect the urine after I dispose of it. I got my gloves, and I also mask up. First thing I do is fill a syringe with sodium chloride solution, 0.9%. I remove the needle and dispose of it. Next, I am going to prepare the catheter. I cut the top part off. And then I also cut a little bit of extra. That's going to be a platform for my lubricating jelly. And then I make a couple more incisions. This is going to provide a place so you could feed the catheter without actually having to touch the catheter. You don't want to touch the tube at all because you don't want to introduce any bacteria unnecessarily. I place some lubricating jelly on this platform. That way it stays sterile and it's just a little bit easier for me to apply the lubricant to the catheter itself. Because I'm doing this procedure twice a day, I use a lot of lubrication. It keeps Mr. Moose from getting irritated. I put even some extra into this little tab that I've created. That way it just keeps the catheter lubricated as I'm inserting it. I also rest the catheter packaging on the side of whatever you have. I use the receptacle just because it's convenient. Just make sure that you don't touch the catheter at all to the side of whatever you're using, if it's the receptacle or if it's something else. You want to keep that as sterile as possible. So for hand placement, first things first, I expose Mr. Moose's penis and I use these 4 fingers to hold back his leg. if for whatever reason your dog tries to subvert your efforts, especially upon initial insertion of the catheter, you may want to place a pillow or a rolled blanket right under this leg here. It helps to hold it up in place. Also, if your dog has long hair, like my Irish setter, you may want to consider tying this back with a hair tie or a rubber band if you find that it's getting in your way. I also like to trim the hair around here. He's getting a little bit hairy, but I usually keep this hair pretty trimmed. That way it doesn't get in the way of catheter insertion. I place a paper towel right underneath. It just helps me see that all of the hair is out of the way, that it's not going to touch the catheter in any way. Another important thing here is hand placement. You don't want to touch his exposed man parts at all, because you don't want to introduce any unnecessary bacteria. So just be mindful of your hand placement. Next, I'm going to clean Mr. Moose off with the sodium chloride solution. In preparation for inserting the catheter. Okay, we're ready to start again. Be very mindful not to touch the catheter at all. And you may find that while you're feeding the catheter into your dog, the paper from the catheter, the packaging, might travel with the catheter. So I usually place either a foot or a knee on the packaging. Like right now, I'm having a little bit of difficulty. That way the packaging does not travel with the catheter as it's being fed into your dog. And then I just gently feed the catheter until it's in place. Your vet will explain to you the size of the catheter you need for your particular dog breed. And you could feel when you're inserting right into the bladder, insertion becomes a little bit more difficult, the resistance. Okay, so the catheter is inserted. I can tell because there's urine coming out the bottom. And at this point, I let Mr. Moose's skin down and attach the catheter and start withdrawing urine. What is very important at this part is that once the catheter is inserted, you do not have the ability to push it in any farther. The reason for this is that the skin is now down on the catheter touching. You don't want to push it in any farther because it's no longer clean. You don't want to introduce any more bacteria into your pup. So once the catheter is inserted, the only direction it should come is out. And then your vet will explain and provide guidelines as far as how much urine output you should be getting on your dog or what they're expecting. Okay, I am nearing the end of the catheterization. It's getting difficult to withdraw the liquid, and I usually pull the catheter out just slightly to make sure that I haven't hit or that I've gotten all the pockets of urine, because the bladder is kind of like a bit of a water balloon. Okay, your vet will explain how to know when you've reached the end and gotten all the urine out. When you're no longer retrieving any fluid and pulling back and it's difficult, you're at the end of the procedure. I remove the catheter, and there you have it, one-person catheterization. Full. You can see Mr. Moose tolerates the procedure very, very well. Your vet will explain to you the signs and symptoms to look for if your dog has an infection brewing. Again, I hope this video has been helpful, and you got this. You're going to do just fine.